So welcome to our weekly Greenleaf Connect event. Today we begin our May series on mental health awareness and observation of Mental Health Awareness Month. We all know that a part of good mental health is also good physical health. So today's session covers our Greenleaf benefits since it's open enrollment time. Before we get started, we like to begin with our purpose here at Greenleaf Connect, which is to hold weekly forums for us to get together and talk about all things Greenleaf. Greenleaf Connect creates a place for us to be direct, informative, and build transparency for our audiences on specific and important topics like the ones we'll discuss today. We also like to review our rules of engagement. So first, you can change your presentation view by moving the slider between the presentation and the speaker to make either one bigger or smaller. We do ask that you mute yourself during the presentation portion of our meeting to avoid any feedback as we present. And we will hold a live Q&A session at the end of the presentation, so have your questions ready for us. And a friendly reminder that this session is being recorded and will be made available on the Greenleaf Connect Workplace page for future reference. On our agenda today, I'll go over some open enrollment notes and the enrollment timeline, benefit changes for the upcoming year, how to review your current elections and view other plan options, and what other resources are available to you if you need any assistance. And as always, we'll conclude with our Q&A and some important upcoming dates. So to start, some open enrollment notes. So first, we want you to go through the enrollment process regardless of your intent to stay with the same plan, because it's really only you that knows what's best for your family. And if you've had any changes, this is your time to review your options and make decisions that fit your lifestyle and your budget. And any existing plans or coverage that you currently have will automatically roll over if you do nothing. But again, we highly encourage you to go through the process so you can see what the new rates are and what options are available to you. And one note is that the HSA and FSAs do require re-enrollment. So if you are currently signed up for those and you want to keep those, you'll want to sign up again. So do that during the open enrollment process. So for our timeline, open enrollment started yesterday and will go through May 19th. New plans and rates go into effect on July 1st. And then payroll deductions will begin your first paycheck with the pay period end date in July. And our plan year is July 1st, 2022 through June 30th, 2023. Now, if you miss the open enrollment period, you won't be able to make any changes until May of next year, which is our next open enrollment period, unless you experience a life status change event later in the year. And for that, you need to notify TriNet very timely, because there are rules around what those life status change events are and how much time you have to make changes to your plan. Now, something important to note is that even though our plan year is July 1st through June 30th, is that deductibles on your current plan are actually by calendar year. And so if you have questions about how that deductible would work if you're switching plans or switching providers, you'll definitely want to reach out to your provider or TriNet to figure out how that's going to work, because it's really dependent upon what plan you're currently on and if you're changing providers and such. But again, the deductible is a calendar year and our plan year is July 1st through June 30th. Now, for benefit changes, RISA did send out an email that let us know that the average increase of healthcare costs went up 20% this year, which is the norm across the US. It wasn't just our company or anything through TriNet. But to help mitigate this increase to you as the employee, Greenleaf is going to take on a portion of this increase. But that amount of coverage depends on what plan you choose and if you roll just for yourself or you're adding any dependents or partners. So again, it's important to go in and look at the different options for you to see what those increases are going to be in the end. And then to view your current benefits and explore your options, you're going to want to log into TriNet. And then you can see your rate changes for your current elections. So what changes have been made if you stick with the same plan that you currently have. But then you can also review and compare other plan options. So there's health, vision, dental, short and long-term disability, hospital indemnity, and life insurance. So lots of options on there. You can choose all of them, or you could choose none and waive your options.
And Natalie, I'd like to add that when you go through the process under each section, so like short-term disability, long-term disability, FSA or HSA, There's also very good descriptors that are very easy to understand that tell you a little bit more about it. So be sure to scroll all the way to the bottom and get more information on each section.
Great. Okay, so we have this benefits enrollment demo. It's a little robotic, so I do apologize in advance for that. But it's very useful. I mean, the nice thing about TriNet and our benefit platform is that we have so many different options, but at times that can be overwhelming, especially navigating the system and figuring out where you are in each section of the benefits enrollment. So this enrollment demo is about 4 minutes long. So I'm going to play that here for us. I've watched it a couple of times and it definitely does help prepare you to log in the system and see what's going on.
Welcome to the Benefits Enrollment Demo. We will spend our time together on a guided tour of the major features of the Benefits Enrollment site. This demo will highlight some of the important features to help you elect your benefits. To access the Benefits Enrollment site from TriNet, click the Go to Enrollment prompt. The first page we see is the Welcome page. Here you'll see the benefits plan year and the benefits eligibility date prominently displayed. Additionally, on this page, we see the deadline to submit elections. Let's go ahead and get started. A screen will appear where you'll be able to add your eligible dependents information. We recommend you add your dependents in the beginning of the enrollment process. Once all your dependents have been added, you can start electing your benefits. Please select the dependents you wish to enroll and click Next. At the top of the page, the benefit elections are listed under Menu. This collapsible menu will show you all the elections you'll need to complete. Once you have completed an election, there will be a green check mark beside the election. Click on an election to go directly to that page. You can complete your enrollment in any order by utilizing this menu. Additionally, if you click out of the menu, you can choose which elections to complete. In order to move forward or backward individually between the pages, use the Continue or Previous buttons, the handlebar navigation, or the hamburger menu. It's important to note that the Benefits Enrollment site will only display the benefit offerings you're eligible for. You'll notice as you review each election page that your enrolled dependents are listed on the right-hand side. You can see all the plans you're eligible for by clicking on the Card View or List View, whichever you prefer. Also note that plan details, such as deductible and out-of-pocket maximums, are displayed for each election of medical, dental, and vision. If you have a favorite plan, you can click on the star to the right of the election and mark it as a favorite. This will change the color of the star to orange. You can use favorites in case you leave a page, then return later to elect a plan. Once you've enrolled in a plan, you'll see a green enrolled icon. As you begin to choose plans, your cost per pay period will appear based on the plan you've elected. This is the total amount deducted from your paycheck each pay period. To compare plans, check mark Compare located on the left-hand side of the plan offerings. You can compare up to 4 plans at once. Once selected, click the Compare button in the Compare drawer and a side-by-side comparison of the plans will display. To edit your comparisons, click Edit Selection or go back and remove X, the plans to deselect. If at any time you would like to waive an election, click Waive in the upper portion of the screen. You must waive each election separately. Additional features that you will find helpful are resources and need help, which are located on the right-hand side of the screen. When you click on resources, you can explore the carrier contact information, summary plan description, detailed medical comparison link, and a glossary of terms. If you click Need Help, you'll see the contact information for Connect 360 assistance. Once you have completed all of your elections, you'll review and submit. If you missed any elections, an alert message will display, and you'll be directed to the page you need to complete. After completing your elections, you can again use the Continue and Previous buttons, the handlebar navigation, or the hamburger menu on the page to go to the Review and Submit page and review and submit your elections. Last, you'll want to review your total benefits cost. Again, this is the amount that will be deducted from your paycheck each pay period. Next, verify your benefit elections by checking the box. To process your elections, verify or enter an email address and click Submit Benefit Elections. You'll receive an email confirmation of your elections to the email address you provided. If you do not complete this step, your elections will not be processed. Thank you for attending our demo on the Benefits Enrollment site.
Okay.
Natalie?
Yeah.
And I might be overstepping, but and you might have noticed this as well. I don't want to confuse anybody when they watch that video.
Uh-huh.
Those are just blanket dates.
Right. Yeah.
That is not our date. Our dates are in the open enrollment for each person, so they are correct in your profile.
Great. Thank you for confirming that. So some additional resources. So Risa sent out a great email that has all the links. And then also we received a follow-up email from TriNet for open enrollment that has these 2 links in it. And so that's open enrollment, why it's important. I think we've stressed that enough here for you to take a look at all the options available to you, especially due to the price increases. We don't want anybody to be surprised. And then benefits terminology and plan types. This is always helpful. I mean, benefits can be so overwhelming, and the words that they use, they're not normal. So if you click on that link, it will also take you so you can look things up if you have any questions about what the plan is, explaining that it covers and whatnot.
One thing on that, Natalie.
Yeah.
So you guys may have noticed recently that TriNet now is offering what they call a healthcare advocate. And this was started pretty recently. And if you go into your profile, under benefits, there is a healthcare advocate section. And what they do is, so if somebody's having issues getting a medical bill paid, they don't understand what the doctors told them, they need help getting a second opinion, they don't understand looking at what the invoice says, they can help explain healthcare conditions if you don't really understand what the doctor told you. There's quite a few things that they can do, but it's called a healthcare advocate, and they can help get those bills paid for you. They can help submit, they can help you find second opinions. It is not TriNet that's doing that, but it is a service that TriNet is providing through a company called Healthcare Advocate. So
Awesome.
yeah, so that's something new that they're doing. So be sure to use that service if you need it.
Great. And then other things that you may need if you have any questions, TriNet is really your go-to contact. They have lots of ways for you to reach out to them. So one is their chat, which is available 24/7, available when you log into TriNet. There's a phone number here, and they're open Monday through Friday, 6 a.m. to midnight. So some great hours. And then also an email address. And then of course, Risa is available for any general questions. But again, if there's specific plans or what's best for you and your life or family situation, TriNet is your best contact. Because again, we're not going to give any health advice or anything like that. But again, Risa's always there if you have any general questions, or if you're not able to get to the right contact at TriNet, she can help you there as well. So are there any questions? Anika, Stephanie, you guys have any questions about open enrollment or anything with the increases or what's online?
I don't. That video is super helpful, so I'll know to have that pulled up when I get online to enroll. So thank you for sharing that.
Yeah.
Stephanie, I did inquire if they had a Spanish speaking video,
Mhm.
and they did not. They are hoping to get one next quarter. I think honestly, they just don't have the staff to do it right now. So I'm hoping that's going to come soon. But if there's somebody that's confused by any of this, they do have some reps, I believe, that they could call on the chat line, or can call. And I don't know if those particular people are very well versed in the benefits, but it's worth a try.
Yeah, so for any TriNet related things, like if someone had a question about 401k or things like that that are just Spanish speaking only, I've directed them to TriNet's 800 number, and there's an option for Spanish speaking. So I'm pretty sure with even open enrollment, they'll have that available for our Spanish speaking team members. And then next week on Thursday, we're having a lead meeting. And so I'll be sure, it's on the agenda to follow up with open enrollment, but I'll make sure that the leads with Spanish only team members, that we kind of like help them through that process, not make decisions for them, but help encourage them and show them how to do it on the iPad, that type of thing.
Yeah.
So yeah, we'll make it a focus next week.
Yeah, and even if we need to, like, I can always get on a call with them as well if they have needs, if it's somebody who really doesn't understand English very well, and then the lead needs to ask me a question, I'm happy to help that with too, help out with that too. So just let me know.
Perfect. Thank you.
Okay, so we will now go on to our upcoming dates. As always, this recording will be made available on Workplace tomorrow. And then we have some updates for our volunteer activities. So for May and June, May, I just got off the phone with the Red Cross, and they're going to try to do a blood drive at our office on May 31st. I'm getting the specifics and we'll pass that out, but hoping that we can get a lot of participation. We need at least 30 people for the Red Cross to actually come to our site. And so there will be a sign up form that will go out either tomorrow or Monday for everybody to sign up for a time slot for the 31st. And we're going to hold that at building 6055. So just stay tuned for more information there. And then for our second quarter volunteer event, we're going to volunteer at Fire Station 16 and do a landscaping project. So really excited. Shirley Ann Smith with the Atlanta Fire Foundation did a session for us during Women's History Month. And so to kind of pay it forward back to the fire station, this fire station is actually located near Fairway. So really excited to give back to the community and a fire station that serves one of our properties. And then not on here, but if you joined us yesterday for our Park Hill summer camp discussion with Josh, definitely stay tuned for sign up for volunteering for the summer camp in July, late July. We definitely need as many volunteers as possible. We did outline that if you're not available, probably won't be available the entire week, but you can volunteer for a full day or a half day. And then we're also looking for employees to host activities. So if you have a special skill set or something that you think would be a fun activity to host with some of the kids at the summer camp, there's going to be an opportunity to let us know what you would like to host there as well. And then a plug for our new survey and recognition system, Kazoo, that's coming soon. Marisa will share more details with us as those become available, but Tiny Pulse is on pause, right, Risa, as of now. So you won't get your weekly emails, but we're always here if you have feedback in the meantime, so don't hesitate to reach out. But Risa will share with us once Kazoo is live and kind of give us an introduction of how that program is going to work. Then as far as our Greenleaf Connect schedule, next week we actually get to meet with Mary Lane, who is a professional that works for Whiteford Inc. And Whiteford Inc. is actually a partner with our foundation. And we do some neat programs with them through the foundation, one being our snacks program for after-school snacks for underprivileged children. And then also our food prescription program at our market, if you've heard about that. Whiteford Inc. is a healthcare center that people can go to, and for some health conditions and ailments that some things are better fixed through food. And so they'll write a prescription for healthy fruits and vegetables that then people can take the prescription to our market and get those foods at a discounted cost. So we're happy to invite our Whiteford Inc. partner, and Mary Lane's going to talk to us about employee wellness thriving in the workplace. I think this is going to be focused kind of on how the shift of COVID and our mindset and everything in the workplace has changed a little bit and how to continue to thrive. Then on the 19th, we'll be going over maintaining good mental well-being. And then on the 26th, we're welcoming back another Whiteford Inc. employee, Amina Porter, and she's going to talk about recognizing the signs of substance abuse. Then a friendly reminder about our Kudo platform to participate in some development programs of all different areas. And again, Kudo will be a part of the Kazoo point system and recognition. So you'll get to see how that's going to work. And our hope is that anything that you've already taken on Kudo, you'll get points for those as well. So definitely keep plugging away at anything that you're doing on there. If you have any questions about the system, programs, or logging in, just let me know. I'll be happy to help. So thank you all again for participating in today's session, and we look forward to seeing you guys next week as we continue our mental health awareness series. And thanks again, and enjoy your day.